Hello, I'm Dr. Brandt Gibson, and tonight I'd like to talk to you about plantar fasciitis and one of the treatments that we actually commonly use. The treatment is laser treatment or MLS laser treatment. Quick reminder, plantar fasciitis is an inflammation of the ligament on the bottom of the foot. So you have the heel, you have the Achilles tendon that attaches, and the plantar fascia attaches on the bottom. The plantar fascia is pulling off. It gets inflamed, painful, and tender. And a lot of times the treatments that are designed are to decrease the inflammation and help in that way. So in this case, MLS laser is a very effective and very valuable type treatment. So the idea, you get the plantar fascia that's swollen and it causes pain. When you sit down or lie down at night, it tries to heal, but then when you start moving again, it re-tears, re-injures, and you basically start all over again. So the idea with the MLS laser is there is a treatment method that doesn't hurt, that is as aggressive or oftentimes more aggressive at decreasing the inflammation than a cortisone shot would be. The other advantage is over all other treatments, I guess I should say, the other advantage is it actively treats the plantar fascia at the cellular level to cause healing. So MLS laser does two things: decreases pain and swelling and stimulates healing. So let me explain how that actually works. With the MLS laser, it's a multi-frequency laser. And it's a multi-lock sequence. It's basically what MLS stands for. And what you've got is you've got an 808 nanometer laser and a 905 nanometer laser. Both are stage 4 lasers and can cause pretty significant pain, can cause pretty significant burning or whatever if they were just used at that level, and they would cut just like any stage 4 laser would. In this case, you've got two frequencies of laser that are switching quick enough that it doesn't cause heat, doesn't cause damage, and doesn't cause injury, but it does allow an aggressive decrease in inflammation, an aggressive decrease in pain, and aggressive healing at the cellular level, causes the cells to divide, causes the repair of RNA, DNA, and the cell membranes and so forth through the use of this laser light. And the advantage of that is, as opposed to most treatments with plantar fasciitis, you're actually doing more and you're actually causing it to heal so you can get back to normal and continue normal activities and normal functioning. So MLS laser is a valuable treatment. It's something that should be considered, especially since there is no associated pain and there is no long-term side effects. So what's the method? I guess I should say. Let me explain to you how MLS laser works. It's not just a one-time treatment. It usually takes anywhere from 6 to 10 treatments to aggressively decrease that swelling and stimulate the heal. Although usually somewhere between 3 and 4 treatments, you're going to notice a pretty significant improvement. So 6 to 10 treatments that it will take, you'll see improvement after 3 to 4. In most cases, you get resolution, and it seems to be long-term resolution. As with any other laser type treatments, the MLS laser is found to be 85% effective on most things that it treats. We're getting a little bit higher level than that when we're treating plantar fasciitis. And so it's a good option. The big negative, or the side effect, the big negative is probably the best way to say it. The big negative of MLS laser is because it's a relatively new treatment, insurance does not pay for it. There is actually no codes to allow it to pay for it. And so it is a cash type treatment. We are able to do that at a discounted rate because of how many lasers we actually do. So I'm Dr. Brandt Gibson, and this is your Podiatry Tips Day 224. MLS laser treatment for plantar fasciitis. Thank you for being here. Thank you for listening. Have a great rest of your night.